The Atlanta Braves announced today that Spencer Strider underwent an MRI, which revealed damage to the ulnar collateral ligament in his right elbow. As of right now, he's planning to have a second opinion with Dr. Meister in Arlington, Texas, at a date that still has to be determined. This is a concerning finding because this is the ligament that's involved in the Tommy John surgery, and we all know that Strider had actually had that done already in 2019. The severity, also known as the grade of the UCL injury here, is going to dictate obviously his path moving forward, and that's something I definitely want to focus on with today's video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy, and with my channel I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I will also go into the relevant anatomy of that injury and talk about what that person should expect when coming to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have any experience with a UCL injury requiring Tommy John surgery, go ahead and comment in the comment section below. Now, I don't have a model of the elbow, so I'm just going to use my arm here, but the ulnar collateral ligament is actually located on the inside or the medial portion of the elbow, and it's called the ulnar collateral ligament because it's on the side of the ulna at the forearm. So at the forearm, we have the radius, which is on the thumb side, and the ulna, which is going to be on the pinky side. Right here, the ulna is going to attach to the humerus, and then we have that ulnar collateral ligament that's going to prevent the separation of the two bones of the joint. When we talk about injuries to the ulnar collateral ligament, there are typically two types of scenarios where this is going to happen. This is going to happen in the first scenario, which is characterized by overuse. So anybody that is going to be throwing a lot or doing any sort of overhead repetitive motion. And then the second one is going to be a trauma. So somebody that's going to fall on an outstretched hand, putting a lot of stress going through the elbow. When a person is going through a throwing motion, they're going to come back and cock their arm like so. And as they come forward, this is going to place a lot of what's known as valgus stress going through the medial elbow, which can predispose them to an injury to the structures located medially. This valgus force, if great enough, is going to try and separate those ulna and humerus bones, which is why if a person is just getting a lot of repetitive stress trauma over time, that can lead to damaging that structure. Signs and symptoms of ulnar collateral damage can include either stiffness at the elbow. Sometimes people actually feel a pop on that inside portion of the elbow there. And then if the injury is actually severe enough, they can feel numbness and tingling actually going down to the pinky and the fourth digit here. And this is because that ulnar nerve is going to come down the medial portion of the elbow. And so if it's just very unstable, that nerve can get irritated. All of this is going to make throwing extremely painful. And this is when a person is going to have an official examination. There is an on the field or in the clinic test we can do to determine if we essentially think someone is dealing with a UCL injury, and this is going to be a valgus stress test. So what we're going to do is we're going to straighten the person's arm, and we're going to apply a valgus force going from the outside coming in, basically stressing that medial portion of the elbow. This isn't the most reliable test to do. However, this is what we'll do in case there has not been any imaging. The gold standard, of course, is going to be the MRI. And this is where we're going to get into the grading system where there are going to be grades 1, 2, and 3. In a grade 1 UCL injury, this is where we're going to get stretching of the ulnar collateral ligament, but there's no tearing. In a grade 2, this is where you're going to get some partial tearing of the ulnar collateral ligament. And finally, in a grade 3, this is where you're getting that full rupture, which is obviously the worst case scenario. Whether or not somebody has surgical intervention is going to depend on the severity of the injury, obviously, as well as how that person presents during the examination. So they're going to look at overall elbow instability and essentially see how that person presents. Now, if a person elects to have that Tommy John surgery, usually this is implicated in those full ligament tears, and they're essentially going to rebuild the ulnar collateral ligament again, and they're doing this with the overall goal to restore stability and range of motion to the person's elbow. Now, the negative connotation with Tommy John surgery obviously is the long recovery time, and this is because it takes anywhere from about 12 plus months for that person to make a full recovery. I expect all of us to hear the update on Strider's case after that second opinion he has with Dr. Meister, and if I happen to hear that first, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So we wish Spencer Strider the best of luck moving forward. Obviously, we hope that is more along the lines of a grade 1 or a grade 2 strain of the UCL. If it is at grade 3, unfortunately, it's going to sideline him for a significant portion of time. Thank you so much for tuning into my channel today. If you enjoy this sort of content, I'm going to go ahead and link one of my playlists so that you can essentially watch some of the videos that I've talked about in the past. Thank you so much for tuning in, and I'll see you next time.